So obviously education in general and cancer awareness and cancer education is important. I think we all have a responsibility towards making that happen. The print media, the television, the social media, and it has to be the correct information.
How often does dysmenorrhea signal a more severe underlying condition, such as endometriosis or gynecological cancers?
If there's lack of awareness and lack of medical facilities, like in rural areas, then obviously either diagnosis will not be made correctly or it will be delayed. And if there aren't any cancer hospitals which can offer chemotherapy, radiation and/or surgery, then of course treatment has to be delayed, will be delayed, because patients will eventually need to travel to bigger cities, to bigger centers to get the treatment. And so a lot of times treatment is delayed because they cannot approach us on time. They come from smaller cities where there are no big hospitals to make the correct diagnosis and offer the right treatment at the right time.
What symptoms or red flags should women monitor that may indicate the need for a deeper medical evaluation?
So we say any change in the body that a woman experiences, a young woman or an older woman. For instance, if there's in an older woman where the periods have stopped many years ago, if they have new onset bleeding or spotting, it needs to be investigated, because not all new spotting or bleeding will be cancer, but it's one of the symptom of a cancerous condition in the cervix or the uterus, so it needs to be investigated.
How can cancer awareness campaigns integrate dysmenorrhea education to encourage early detection of serious conditions?
So obviously education in general and cancer awareness and cancer education is important. I think we all have a responsibility towards making that happen. The print media, the television, the social media, and it has to be the correct information, because bad information also leads to bad results. So information has to be correct. It has to be on scientific basis, what we call evidence-based medicine, and only people who are experts in those fields should be talking about it, because we don't want laymen or lay people talking about how to diagnose cancer, what treatment to take, what not to take. That happens a lot.
What are the latest advancements in diagnosing and treating conditions associated with secondary dysmenorrhea?
So in Pakistan, there's a dearth of institutions, doctors, we are short of oncologists in this country, even though we are training more and more people, but a lot of people. We have a huge population to serve, and most doctors are in bigger cities, so a lot of people in smaller cities and villages have no access to medical oncologists or to radiation oncologists, or even to surgeons who do cancer surgery. But in bigger cities, we do have, for instance, at SIUT and other big hospitals in the city, there's a lot of equipment that is more advanced. There's updated. We have PET CT scans. We have other scans in the city. We have lots of blood tests, and there's something that cannot be done here. It can be sent outside. So yes, we don't have enough, but we certainly have a lot of new equipment and testing in the city.
Are there specific risk factors in the Pakistani population that might contribute to secondary dysmenorrhea, requiring specialized attention?
Gynecological cancers are common cancers all over the world. Cancer of the cervix, of the ovary and the uterus. These are common cancers of the female after breast cancer, common cancers in females. So, like any other country, we are bound to see these cancers. There are certain syndromes or some cancers run in the families. So genetics plays an important role at times. Then we don't have screening, say for cervix cancer, which for all women who require it. So that's why a lot of cervix cancers get missed, because they get diagnosed only in the advanced stages.